Please welcome back to the stage the Chief Evangelist at Authenticx. Here's Leslie Pagel. Hi, Leslie. How are we doing?
Doing great.
Yeah. All right. We just saw you, and you told us a little bit about Authenticx, but maybe you can share with us a little bit more about you and what you want to inspire our audience with.
Absolutely. Well, I'm Leslie Pagel. I've spent my entire career working with organizations to create an advantage through the experiences that they deliver. And in these next few minutes, what I really hope to accomplish is to spark some curiosity in all of you. And that curiosity being for a new approach to listening to the voice of your customers and the voice of your patients and caregivers.
Amazing. Our studio team is just collating those results, so we'll review them in just a minute. But I'd love to kind of talk a little bit more about what I spoke about when I introed you, listening at scale. What does that really mean? Can you define it for us?
Yes. Listening at scale is the act of taking all of the conversations that patients and caregivers are having with you when they call to schedule an appointment, when they interact with the nurse triage team. And it brings all of those conversations together. And what happens is listening at scale really works best when we take a both and approach. And what that means is we leverage technology, we leverage artificial intelligence, machine learning to give us the breadth of understanding about the conversations that are happening within your business. It helps us understand how common themes, how those themes are changing. But also when we use humans to listen to those conversations, we get a lot of depth of understanding. So technology and AI kind of with conversational intelligence gives us an aerial perspective. When humans listen to calls, it paints in that aerial view with a lot of color and context, helping you really kind of fully understand the nature of the interactions that your customers are having with you as well. What we have found in working with healthcare organizations is that harnessing these customer conversations that are taking place is the best renewable source of insight that the business has about your customers.
Yeah, and that's the data we need in order to move forward and to keep improving experiences. Thanks, Leslie. We do have some of the poll results ready, so I'd love to take a look at those results and have you weigh in. The first question we asked the audience, if you could only have one type of information to inform your next strategic decision, which would you choose? Let's see what they voted. Okay, clear winner here. Customer behavior data. 0% said other. Not a lot of people said operational data. What can you make of these results, Leslie?
Well, it was a little bit of a trick question. And that is because what we found is when your customers are interacting with you, they share a wealth of information. They share their sentiment, their feelings, their perceptions. They share where they've been, where they're going, the behavior data. They share how they're feeling, clinical data. So it was a little bit of a trick question because when you study conversations, you get insight into all of those categories.
Fantastic. And, the next question is good. And we had a couple of people vote other. I'll read those results in just a minute. But we asked, what is the biggest current challenge or gap with your current customer patient feedback approach? Let's see the results for this one. Okay, 34% lack of representation. Interesting. Other 9%, Karen said other timeliness of feedback, and Rita said resources prepared to respond to the feedback. What do you think of that?
Yeah, what we see is that hospital systems, payers, pharmaceutical companies are relying heavily on survey data. Mm-hmm. And what happens is there's a lot of doubt and skepticism about survey data being the voice of the customer. So I'm not surprised to hear about timeliness. There's a delay in getting survey responses. We all know that the representation of the voices of our customers aren't aren't complete in survey data because let's just face it, most people don't respond to those surveys.
100%. Why is it important really to consider a renewable source of insights for that strategic decision making, especially in today's environment?
Yeah, so conversations are a renewable source of insight, and it's important really for three reasons. One is the pace of change is so fast today, and it just keeps getting quicker and quicker and quicker. And so we need a source of insight about our customers that endures time. And our customers they're not going to stop talking with us. They're not going to, we don't want them to stop talking with us. Another reason is conversations allow you to deliver insights across the entire business. We learn about scheduling. We learn about the patient portal in conversations. We learn about our nurses. We hear about the physicians. We hear about discharge. They share their experience with us in their conversations. So it serves a wide audience of stakeholders in the business. And then the last thing I would just say is, all of our behaviors are driven by our past experiences. And if we want our customers, our patients to keep coming back to us, to be the one that they select, we've got to be listening to them, and we need to understand, and we need to use that understanding. That is the greatest display of love, actually, is listening, understanding, and then acting in a way that helps improve the experience and delivers patient outcomes as well.
So, you've explained the importance of listening, obviously. You've defined what it means to listen at scale, but can you provide us maybe an example of how listening for deeper context can really drive this impactful change?
Yes. Well, we work with one hospital system that is very focused on helping patients get the information that they want when they need it. And so they're really trying to drive the use of their patient portal. And through a conversation, you get both sides of the interaction. So we were able to hear the customer service representatives and how they talked about the patient portal. And what we found is that some of them really did a great job and others not so good. So we're able to see how the own brand was representing the patient portal. And then when we heard from the patient, we heard all kinds of barriers that they were having or issues with the navigation. So through that, we were able to provide some coaching to the agents to make them feel more comfortable in how they talk about the patient portal, and also drive improvement feature requests to the digital team as well.
Perfect. What's one final thing too that you'd like to really just leave the audience with so they have some great insight to take back to their teams?
I will say kind of where we started this session today. It's about leading with love, and there is no greater display of love than to fully listen. And the technology exists today to do that at scale, to listen to all the voices of your customers. It is what we find is it has historically been stored and ignored. These conversations are in the business, but they're just sitting dormant. And we have an opportunity really to activate those conversations and show our customers, our patients, our caregivers, our members that we're listening and that we're acting on the voice that they share with us.
Yeah, we're care leaders. We need to show that we care, and listening is a big part of that. Leslie, thank you so much. And last question for you, what's next for Authenticx?
Oh, wow. Well, we're continuing to invest in artificial intelligence. We
Nice.
are we only listen to healthcare conversations, and we listen across the entire industry. And so we're building machine learning models, artificial intelligence models that are healthcare specific, and really being at the forefront of helping the industry listen at scale.
Perfect. Well, Leslie, it was a pleasure having you again on the stage. Enjoy the rest of the summit. We hope to see you back soon.
Thank you.
Great.